everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health, which focus on urticaria or hives, which we or our near and dear ones that faced or encountered at some time in their lives. Urticaria is characterized by round rash on the skin that itch intensely, due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes because of unknown. As a study published in Indian Journal of Dermatology and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of the patients are in the age group of 20 to 40 years. Incident is higher in old age group. Urticaria is classified by acute and chronic, but the most important part is not to ignore, and doing self medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment, and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Aruna Pawar. She's an MBBS, a DVD dermatologist, cosmetologist, and trichologist, and has an experience of 10 years in this field. She completed her MBBS from Maharashtra University of Health Sciences, Nasik in the year 2014, and DVD from College of Physicians and Surgeons of Mumbai in 2019. She has years of experience in this field, and her skill and compassion has made a tremendous difference in patients' lives. A warm welcome to Dr. Aruna Pawar. It's a pleasure to host you today, Doctor, and we are going to discuss about a very important topic today, which is management of urticaria. So first of all, I would like to ask you the regular question: what is urticaria?
Yeah, so basically, very good evening to all. Urticaria in layman term, we can call them as hives, or they are something like a red rashes. They are occurring all over the body, and likewise, we in the scientific term, we can call them as these are the elevated red lesions, erythematous lesions occurring on the body, and the morphology they can be a uniform that the similar morphology of all the lesions, or they can be differ. Okay, so basically we call them as wheels or hives. So these for the layman term, it is a red rashes occurring sudden occurrence, and they can be on and off in the occurrence. Sometime
Right.
they can go on their own, or sometimes some after some medications they can go. So basically they are on and off type of the erythematous red lesions occurring over the body.
Right, right. Doctor, so the main issue with any cause, any condition, any disease is identifying the disease. So, our skin being the largest organ, there are so many things happening in the skin every now and then. We see changes and we tend to ignore them. So, what would be that thing to identify urticaria? And how would one know that this is urticaria? How can they differentiate from the rest of the skin condition?
Yeah, so basically, there is some change in the like anything, the symptomatic, like the same. Already have told you ki there are the erythematous red lesions occurring over the body, and the
Hmm.
morphologically the lesions can be same or they can be differ in the morphology. So there are some similar lesions. There are 1,000 or 1,500 lesions. They are occurring over the skin disorders, but particularly these lesions after the treatment or with the decreasing the aggravating factor or stimulating factor, they can go away. So likewise we can call them as on and off in the occurrence. They are erythematous lesions, and obviously the aggravating factor or stimulating factor, if you are removing that, the rashes can go off.
Right. Speaking about aggravating factor and stimulating factor, doctor, what can be the cause behind this? What many causes do we have behind urticaria?
Yeah, so basically like you said, there are different causes of urticaria. So basically in daily to daily basis OPD patient में OPD basis में जो भी patients आते हैं, they are telling कि मैम उस दिन वो खाया था उसके बाद आया. So basically sometimes a food allergy, sometime any drug history, we can ask कि कुछ सर्दी खांसी हो गई थी उसके लिए they are taking some medicines and due to that the regions are occurring. There are some cold urticaria, there is also the hot urticaria also. So basically they are saying कि नहीं मैं एसी में बहुत टाइम तक था उसके बाद मुझे अर्टिकारिया आया. और देन समटाइम दे कॉल कि बहुत ज़्यादा हिट था, या सोलर अर्टिकारिया कि मैं बहुत धूप में ज़्यादा टाइम काम कर रहा था उसके बाद आया. समटाइम्स देयर
हम्म
मे बी अ डिफरेंट conditions like after a physical exercise, like after a gym or something if you're doing, तो उसके बाद भी बहुत सारे पेशेंट्स को अर्टिकारिया आता है. Some emotional stress if they are undergoing, so that can also cause a urticaria to develop. So there are the different, and sometimes there is nothing, no cause is there, and this kind of idiopathic urticaria we can call them as, and sometimes the autoimmune urticaria is also there. So due to altered immunity of your own, you are getting some such kinds of urticaria lesions over the body. So these are the different causes for the urticaria, and there are depending upon the acute occurrence and the chronic, there are the different types of causes are there. So basically one aggravating factor is there, like I have already enlisted that cold, then
हम्म
heat, then
हम्म
emotional stress, then food allergy, then drug, then medical history or something like that. And also the some kind of idiopathic कि कुछ reason ही नहीं पता है कि basically हुआ क्या है. And sometimes the
हम्म
autoimmune, due to your altered immunity you are getting such kinds of lesions over the body. So these are the different causes enlisted there. Yeah.
राइट राइट. तो बेसिकली बहुत सारे कारण हो सकते हैं अर्टिकेरिया का. एंड समटाइम्स द कॉजेस आल्सो अननोन, नहीं पता चलता है हमें कि क्या कॉज है इसके पीछे. डॉक्टर, precaution, any precautions people can take, because we have heard urticaria is not contagious, we have heard that it cannot be transferred genetically. So how do one uh, take precautions for urticaria, and who needs to be taking those precautions mainly?
या सो बेसिकली ऐसा कोई पर्टिकुलर नहीं है कि हु हैज टू टेक अर्टिकारिया, क्योंकि वी
Hmm.
नेवर टेल कि किसको क्या स्टिमुलेटिंग फैक्टर और क्या एग्रीवेटिंग फैक्टर है. और कभी कभी
Hmm.
ऐसे हो जाता है कि दिस ऑल फैक्टर्स आर निगेटिव, और पेशेंट कभी कभी
Hmm.
उनको भी समझ में नहीं आता कि व्हाट इज द एग्रीवेटिंग फैक्टर एग्जैक्टली. सो फॉर दैट द
Hmm.
प्रिकॉशन शुड बी टेकन कि यू कैन एनलिस्ट, यू कैन मेक अ डायरी ऑफ योर ओन कि नहीं,
Hmm.
और यू कैन मेक अ चार्ट कि नहीं उस दिन ये मैंने खाया था तो उसके बाद मुझे आया, तो दैट फूड should I avoid or something like that, or you have to minimize from your diet. जैसे हम बोलते कि
Hmm.
कुछ पेशेंट्स आर देयर कि चने की दाल खाने के बाद मुझे आया, चने की दाल का कुछ खाया था मैंने उसके बाद आया था. कोई बोलता है मैंने फिश खाया था उसके बाद आया था. घर में पेंट चल रहा था उसके टाइम पे भी आया था. सम ट्रेकिंग और सम लाइक प्लांट, और उसमें कुछ काम किया था उसके बाद आया. So basically you have to maintain your own diary, and this is with the personal experience. ऐसा पर्टिकुलर नहीं है कि मुझे सपोज कोल्ड एलर्जी है या कोल्ड का रिएक्शन आता है लाइक अर्टिकारिया, इसी में मैं काम करने के बाद मुझे अर्टिकारिया आता है, तो दैट इज नॉट नेसेसरी दैट इज एप्लीकेबल फॉर ऑल पीपल.
Hmm.
समटाइम्स
Hmm.
have a different aggravating or triggering factor. So for that, I should maintain a distance from the cold, and they can be from the other factors also. So these
Hmm.
are the different things, and the personal things and the personal diary should be maintained according to that, and then they have to avoid such kinds of
Right.
incidents.
Right, right. Moving ahead with the with the next question, doctor. Does urticaria look different in all the different parts of the body? Suppose the reason can be different or the cause can be different. Will the lesion look different, or is it the same all the time?
Yeah, the morphologically they can be different. Sometimes we is a in layman term we can call the wheels aate hai, the red lesions are there, the sometimes there are elevated lesions are there. So
Mm,
morphologically they can be differ, लेकिन they can involve the all parts of body also. और कभी कभी जब थोड़ा सा serious और there is some serious condition, then there is a lip swelling, then there is a swelling over the tongue, then difficulty in breathing. So symptoms and signs can be different, and morphology histologically the lesions also can be different. Sometimes they are like elevated nodular lesions, sometimes there is a papular urticaria, some tiny papules are there all over the body. Because of the onset and with the proper clinical evaluation, we can differentiate from the other disorders.
Right. Speaking about clinical, we can find it out. So, what are the diagnosis of urticaria and the current treatments available for both acute and chronic urticaria?
So basically, acute urticaria, the lesions can last uh, like up to the 6 weeks, we can say कि उसको टू like 15 days में एक बार आया या 2 weeks में एक बार आता है या twice a week आ जाता है. So basically with the medications and with the proper treatment, with the removing of the aggravating factor, that will go. So it is come under acute urticaria. When it comes under chronic urticaria, the lesions can last after the 6 weeks also. So and the like frequency of occurring these lesions are like for the long term after the 6 weeks. So this is the chronic urticaria. So basically acute and chronic, the clinical evaluation is most important thing. So dermographism करके एक test भी आता है. So we are doing into the clinic. So we are scratching the patient skin and we are like try to elicit कि वहाँ पे कुछ और ज़्यादा lesions आते हैं कि नहीं. So that is one clinical evaluation, and itself the lesions का morphology है, like the erythematous elevated lesions, then the uniform morphology or the different morphology with the relieving of the aggravating factor, it will go with the proper medicines, it will go. So likewise the itself the lesions का जो morphology है उसके साथ, and the patient can tell the proper history if his patient is like that, उतना conscious है या उतना awareness है उसमें कि नहीं मैंने उस दिन वो खाया था उसके बाद ही सर मुझे ये आया है. So we can
Hmm.
notice also that key some the patient ka past history and the symptoms and obviously the signs and this clinical evaluation, and with the proper blood test if are required, we can evaluate for the urticaria.
Right. Doctor, any other disease or condition that can also trigger urticaria?
Yeah, basically not exactly a disease. Sometimes, if for the any primary disease is there, and due to that the patient is undergoing some medications. So due to that
Hmm.
medicine allergy, he or she can get a urticaria. So in case of
Okay.
like pregnancy, it is a immunocompromised stage. So again, in case of that also, due to hormonal influence, we can have a urticaria. This is a pregnancy-induced urticaria. So in case
Right.
of these some primary disorder is there and due to the medications or due to the any hormonal changes available there, so they can stimulate the directly a pruritic pathway or histamine release more occur in that case, and they can cause a urticaria lesions over the body. Yeah.
Right. Speaking about pregnancy urticaria, doctor, is it curable? Does it like compress, like dominates with time? Does it get vanish while the pregnancy is over? Also, is there any risk for the baby?
Actually, urticaria is over the skin. Okay, so nothing to do with the fetus or something like that. But with the for the medications, you have to ask to take if there is any that requirement is there for the, and the symptoms are so much of aggravating, so much of like the patient is complaining of so much of itching is there, then only we can prescribe her antihistaminic medicines. But yeah, there is some due to medication they can affect on the fetus, but not the directly the urticaria is going to affect your fetus or any morphological changes are there. And yes, due to this immunocompromised status of pregnancy, due to the hormonal changes, the pruritic pathway is getting altered, and due to large histamine release, the patients are getting this kind of urticaria over the pregnancy. But as soon as the she delivers the baby now, so symptoms will vanishes off. So basically it is a
Okay.
due to stage. So and it is not a permanent thing in case of pregnancy.
Right. So what if the patient is treating urticaria at that point of time when she's conceiving? Will that also have some side effects? Can that be harmful?
Due to the urticaria, if his patient is taking a proper treatment and if the proper
Hmm.
clinical evaluation and with the consultation of a dermatologist, if he is undergoing some proper treatment, there is no side effects. Any Generally, in the case of urticaria, we usually give antihistaminics and then
Hmm.
topical medications also. So due to antihistaminics, some sedative antihistaminics are there to go thoda sa sleepiness or something they can complain, but there is not long term side effects or any organ involvement or any side effects on the organs are getting involved. So not like that the permanent side effects or something they are not available in case of urticaria treatment.
डॉक्टर नहीं मतलब अगर पेशेंट उस टाइम पे ट्रीट नहीं कर रहा है वो कंडीशन, वो डॉक्टर के पास नहीं जा रही है क्योंकि उनको लग रहा है कि शायद प्रेगनेंसी की वजह से कुछ चेंजेस आ रहे हैं तो अवॉइड करते हैं, तो ये अवॉइड करना क्या हार्मफुल हो सकता है?
Yeah, obviously you have to look for a proper dermatologist, and then you have to proper get a evaluation ki whether it is urticaria or some other condition is there. So for that you have to look for the that, and after getting a proper analysis and proper diagnosis of urticaria, you have to treat with the antihistaminics that are we are considered for the pregnancy, and these are the FDA approved medicines are there, and you can take and you can get a relief for that.
हुँ,
So basically, to
हुँ,
avoid laziness, because it can hamper, na, like the if symptoms are getting aggravated, the patient is getting
राइट,
some angioedema or something, lip swelling, or then any bronchus and larynx is getting involved. There can be a
हुँ,
difficulty in breathing. There can be anaphylaxis shock. So for that, you don't take that risk and go to the dermatologist and get a proper treatment in case of pregnancy and also the other state of thing.
राइट, राइट। डॉक्टर व्हाट अबाउट स्ट्रेस? कैन स्ट्रेस आल्सो ट्रिगर अर्टिकेरिया? इज़ इट पॉसिबल?
Yeah, actually most of the times ना the patients are giving a proper history कि नहीं मैम ये तो मैंने नहीं खाया था, या मेरा कुछ ऐसा ये भी नहीं है कि एक्सपोजर भी नहीं है, लाइक कोल्ड का बोल
हुँ,
रहे हो, फीवर का बोल रहे हो, फिजिकल एक्सरसाइज. सो लाइकवाइज वी आर रिलीविंग सम फैक्टर्स ना कि नहीं इसके ये ऐसा कुछ हुआ था क्या, वी आर आस्किंग द सम क्वेश्चंस, लीडिंग क्वेश्चंस टू द पेशेंट. Most of the time it is due to only a stress.
हुँ, हुँ,
Nowadays the lifestyle has been a very much have a change, and due to that there
हुँ,
is a, yeah, the 8 to 9 hours का work हो जाता है, then the continuous like screen time, some AC, some light, and then the sun exposure is more, and along with that due to a stress, हम बोलते भी पेशेंट को जितना आप स्ट्रेस लोगे ना उतना ज्यादा रैशेस आ सकते हैं, बिकॉज स्ट्रेस
हुँ,
डायरेक्टली चेंजिंग योर चेंजिंग और इन्फ्लुएंसेस योर हार्मोनल थिंग्स, एंड ड्यू जैसे मैंने प्रेगनेंसी के स्टेटस में भी बोला कि ड्यू टू हार्मोनल चेंजेस वी आर अल्टरेटिंग अ pruritic pathway, and then we can cause a urticaria. So yeah, the stress is most important, and for that also we are advising the patient to minimize the stress and to make a lifestyle changes also.
राइट, राइट। डॉक्टर व्हाट अबाउट कोविड? कैन कोविड आल्सो कॉज़ अर्टिकेरिया ऑन द फेस? इज़ इट पॉसिबल?
Yeah, basically, as already enlisted, in the causes of urticaria, the etiology factor urticaria, the viral infections, yeah, upper respiratory tract infections are getting more involved. So in that case, the COVID again a viral infection. So yeah, it can affect and it can have a rashes over the body. And post in the that COVID era also, like 2 to 3 years, हमने इंडिया में बहुत ज़्यादा केसेस से देखी कि sudden occurrence of urticaria, and particularly autoimmune urticaria is getting also in like कि बहुत ज़्यादा पेशेंट सफ़र कर रहे थे ड्यू टू द कोविड.
राइट। डॉक्टर कॉम्प्लिकेशंस क्या हो सकते हैं? पोटेंशियल कॉम्प्लिकेशंस इफ पीपल, देयर आर अ लॉट ऑफ पीपल वाचिंग अस राइट नाउ, इफ
Hmm.
पीपल आर सीइंग दैट चेंज इन देयर स्किन एंड देन दे आर अवॉइडिंग इट, व्हाट कैन बी द पोटेंशियल कॉम्प्लिकेशंस इफ लेफ्ट अनट्रीटेड?
या सो बेसिकली जैसे मैंने बोला कि जब अब सिर्फ इरिथमेटस रैशेस आर देयर एंड द रेड लीजन्स आर देयर ना, तो पेशेंट स्टार्ट अप्लाइंग सम होम रेमेडीज. उनको लगता है ऑयल लगाने के बाद जैसे एलोवेरा जेल आर दे
राइट।
आर applying and some moisturizing they are putting for soothing. But if it is getting unnoticed now, so it can be converted into a severe form of urticaria. So what is the signs of severe form of urticaria? So patient is getting a lip swelling, there is a tongue swelling, there is a bronchus and larynx is getting involved, there is a voice change, and there is a difficulty in breathing, and so lead to a anaphylactic shock. So that can be a serious condition, and so patient is getting directly admitted into the ICU. So जो lesions आते हैं हम जब उसको like for 24 hours it is like कि for वो lesions आते ही रहते हैं, so go to the dermatologist and have a check
हम्म।
and get medicines done.
Right. Doctor, also we see a lot of patients before going to the doctor, they go and visit the chemist. And the chemist, they probably give them some medications, some steroids maybe for the skin. So how harmful can this be, and how common is this in your day-to-day life experience? How usually do you see patients coming with some medication already, they have had something, or they have applied something on their skin? How often do you see that?
Yeah, basically this is very nice question because in the general practice we are seeing कि patient is having the self medications all the time. So
Hmm.
उनको लगता है
Hmm.
कि हाँ ये itching है तो उसके लिए they go to the chemist and they are taking some medications, and sometimes they getting relief also, and along with that they are also applying some home remedies. So likewise we said कि urticaria has having some stimulating factor, some aggravating factor. So in case of you applying something again more, so it will cause a different conditions. So that can again make a serious of this urticaria, and then उसको फिर dermatologist के पास जाके फिर हमें जीरो से start करना पड़ता है, और फिर द
Right.
medications और सब higher topical medicines उनको देने पड़ते हैं. या
Hmm.
ऑब्वियसली स्टीरॉयड और वो सब की भी जरूरत है. जब सीवियर फॉर्म ऑफ अर्टिकारिया हम खुद भी देते हैं उनको, but that with the proper evaluation, with the clinical evaluation, if some investigations or lab tests are required, then also we can advise to the patient, and likewise that step by step we can go ahead. So directly don't jump on the self medication, that will be very bad and that can be converted into a very serious condition. Yeah, and obviously the anaphylactic shock, I already said about that.
Right. Doctor, people who are watching us right now, आजकल स्किन केयर बहुत ज्यादा, डर्मेटोलॉजिस्ट कहते हैं कि स्किन केयर बहुत ज़्यादा ज़रूरी है हमारे डेली लाइफ के रिजीम में। सो how do you suggest your patients to apply all those skin cares which they are normally taking? Also those oils, the retinoids and the peptides that they get for the skin. Will that be safe for patients already suffering from urticaria, or there is a different kind of skincare which we suggest the patients?
So basically, for the urticaria, person to person, the aggravating and the stimulating factors are different. Obviously, किसी को
Right,
रेटिनॉल को एलर्जी, तो that is not necessary कि all patients को ही रेटिनॉल का एलर्जी हो सकता है.
right,
But
right.
likewise, your skin type is most important thing. How is your skin type, and the how the medicated sunscreen, या moisturizer, या some lip balm or some sunscreen, they are like with the proper guidance of dermatologist you can take. Yeah, and also the
Hmm.
endings, you if you're having some allergy or some content is there कि नहीं पास में से हुआ था वो लगाने के बाद, sometimes I have noticed vitamin C serum. In case of vitamin C serum, lot of patients are getting allergy to that, but due to the social media now, due to the Instagram, YouTube, Facebook, they are watching something new कि उनको लगता है हाँ मेरा भी
Right.
skin ऐसा है तो I can use the similar products also, but they don't
Hmm.
know कि
Hmm.
it can aggravate or it can trigger my some symptoms of urticaria, and it can be a
Hmm.
fatal or anaphylactic shock also. So likewise, you have to a proper evaluation of skin and analysis should be done, and according to your skin, you had the product should be introduced. Sometimes oral tablets, sometimes the topical serum, and sometimes the proper skincare routine with the guidance of dermatologist. So over the counter products and the over the counter online order करके कुछ लगा लेते हैं, द प्रोडक्ट्स कैन बी एक्सपेंसिव, लेकिन फिर वो हमारा खर्चा भी उतना हो जाता है, एंड वी
Right.
आर हैविंग सम आर्टिकल रैशेस.
Right. Right. Doctor, why does this itching normally tend to increase during the night hours? ये रात को ज्यादा itching से बहुत लोग परेशान है अर्टिकेरिया में, तो कारण क्या है उसका?
So basically, like I said, nowadays the lifestyle has been changed. So daily पूरा routine होता है, and that like कि patients are working like 8 to 9 hours continuously, and in at the
Hmm.
night they are like free, and that this is also the change in the like routine now that can also can cause a urticaria. Then we can
Hmm.
see the many times the what we can see कि जो stress induced urticaria उनको हम बोलते भी है कि दिन भर ज़्यादा itching थी या रात में ज़्यादा itching थी, जब आप काम कर रहे थे तो वो इन्वॉल्वमेंट जाता था कि रात में जाता थे. सो बेसिकली वो है. देन जनरली द पेशेंट्स आर गेटिंग सन एक्सपोज ड्यूरिंग द डे ऑल्सो एट द नाइट टाइम, that aggravating factors and that that can be the environmental changes like the cooling at the time of night also. So that can also cause urticaria also. So these are the change in the routine and the change in the also the hot and cold, the temperature change also can cause the urticaria. Sometimes the patients are having the morning routine or up to the evening they are having some work, and at the night they are doing some physical exercise like gym and something like that, and they are going to sleep. Then after the physical exercise also the patients are getting such kinds of urticaria. So their kind of thing, and again hormonal changes and the stress and these factors is also causing the urticaria.
So, is this the reason why urticaria patients are normally seen to be tired? Because they are not able to sleep at night, maybe?
या सो दैट कैन बी अ रीजन, क्योंकि अर्टिकारिया को वैसा ही हो जाता है, और अलॉन्ग विद दैट सब दिस पेशेंट इज अप्लाइंग समथिंग न्यू and irritating the skin more, some aggravating factors are also there, some additional symptoms are also there. So they can be a dehydrated kind of thing, और वो सब उनके बाद वो then fatigability or something they are having due to cold, due to heat, they are experiencing such kinds of tiredness also due to these symptoms. And this was or in case of your body also now, if something is happening like rashes are there, so all the body immune system है, it is concentrated on the rash to treating the urticaria, it is releasing more histamines to getting a relief or some kind of thing. And due to this dehydration and due to this the like जैसे हमने बोला कि नाइट को भी उनको बहुत ज़्यादा जो तकलीफ हो जाती है ड्यू टू द रैशेस एंड द itching, so patient can feel more tiredness.
Right. Doctor, what about patients suffering from diabetes? Diabetic patients में urticaria कैसा दिखता है? Also, क्या thyroid भी trigger करता है urticaria को? Is it possible?
या जैसे मैंने बोला कि ऑटोइम्यून अर्टिकारिया एक नाम की चीज रहती है, एंड दिस दैट इज सेकेंडरी काइंड ऑफ थिंग कि सम प्राइमरी डिसऑर्डर्स इज देयर लाइक डायबिटीज एंड थायराइड, एंड ड्यू टू दैट द पेशेंट्स आर गेटिंग some kinds of medications, and again the body is under a stress to in case of diabetes to maintaining the sugar, again the body is having that immune stress. In case of thyroid also the dryness is more over the skin, and it causes a more like itchiness and irritation over the skin. तो जैसे हम बोलते हैं ना ईच रैश ईच साइकिल, तो उसमें क्या होता है कि पहले तो उसको ड्राइनेस की एक तो अर्टिकारे का इचिंग हो रहेगा ड्यू टू थायराइड, द पेशेंट इज हैविंग अ मोर ड्राइनेस, सेम काइंड ऑफ डायबिटीज also, and the patient is going to more and more itch, and the more of this itch and rash and itch and rash cycle is there. So yeah, the primary etiology is most important thing. So any immunocompromised status or any the already previous diseases there like thyroid disorders and diabetes, the patient is getting urticaria lesions more, and that can be a like morphologically they can look similar also, like there are red rashes, the elevated lesions, and they are on and off in the occurrence. Yeah, they are looking like a same, but yeah, the other factors and the body is under a stress due to these disorders and getting more and more, the frequency can be more in case of these patients.
Right, right. Doctor, what are the dietary precautions one need to take care of during urticaria? What are the do's and don'ts?
Yeah, so basically in case of urticaria the cause जो analysis करने के बाद हमें cause पता चलता है, so we generally advise to the patient to maintain your own diary. So basically if patient is having ने उस दिन फिश खाया था उसके बाद ही मुझे आया है, उस दिन प्रॉन्स खाए थे उसके बाद ही मुझे आया है, या चने की दाल का मैंने कुछ खाया था, चाइनीज खाया था उसके बाद आया है, सो मशरूम और वो सब थिंग. So we are advising patient to make a list and avoid these products or avoid consuming this product the little frequency. First reduce the frequency and try to avoid these products. Basically see someone is having the allergy to fish and other can have a allergy to the chane ki dal also, so likewise that is the difference. So maintain your own diary. If you are feeling कि नहीं मुझे cold urticaria है, so avoid going into the cold environment. Again same kind case of the solar urticaria or heat urticaria. So lifestyle changes are most important. हम patient को बोलते हैं कि
Hmm.
to release the stress you have to maintain a proper lifestyle, then do a yoga, meditation, a proper exercise, maintain your hydration. Your sleep is like 6 to 8 hours sleep is most important thing, like 3 to 4 liters water. The diet with multiple fruits vegetables are most important, and along with that with the proper लिस्टिंग दिस कंडीशंस कि किसके बाद मुझे ये हो जाता है, तो ट्राई टू रिमूव दैट फैक्टर्स एंड ट्राई टू मिनिमाइज दिस फैक्टर्स फ्रॉम योर लाइफ कि डेली टू डेली लाइफ। बहुत सारे लोगों को पेंट का एलर्जी होता है, तो दैट यू हैव टू, या पेट्स, या घर में पेट्स है या प्लांट्स है, तो उनसे उनके भी साथ एलर्जी हो सकती है। सो जैसे हमने बोला कि जैसे नाइट में ज़्यादा अर्टिकारिया के केसेस भी आते हैं, सम पोलन ग्रेन्स आर रिलीजिंग, सम ट्रीज आर रिलीजिंग सम पोलन ग्रेन्स, एंड दे आर also aggravating your urticaria factor. So these are the
Hmm.
different precautions you have to take, and don't self medicate, like केमिस्ट के पास जाके और ये दवा लेके मुझे राहत मिलेगी, तो ये उतना ही कंटिन्यू मत करो। एट द फर्स्ट रैश यू हैव टू गो टू अ डर्मेटोलॉजिस्ट and get a proper evaluation of your skin, and try to the medication prescribed by a dermatologist that will be beneficial for you, and that can avoid a serious conditions to getting converted into that. So likewise you have to proper analysis and the proper medications, and with the proper guidance of dermatology, some investigations if they are suggesting, so you have to do.
राइट, राइट। डॉक्टर, ऑर्टिकेरिया के बारे में हमने आज जाना है। बहुत सारे कॉजेज हैं, इनमें से सबसे वर्स्ट या सबसे डिफरेंट कॉज क्या हो सकता है फॉर अ पेशेंट इफ दे वांट टू नो?
हाँ, अभी तो जब तक कॉज पता है तो वी आर जस्ट रिलीजिंग द कॉज, सो एंड वी आर मिनिमाइजिंग द एलर्जी एंड वी गेटिंग अ रिलीफ टू द पेशेंट। पर सम टाइम देयर कॉज, इन केस ऑफ इडियोपैथिक अर्टिकारिया हमें कॉज ही नहीं पता है बेसिकली, सो वी आर ट्रीटिंग द पेशेंट लाइक ब्लाइंडली कि नहीं उनको एंटीहिस्टामिन दे रहे टू रिलीज द एलर्जी और समथिंग, बट द पीरियड दैट फ्रीक्वेंसी ऑफ दिस थिंग ना एपिसोड्स आर गेटिंग कि नहीं नहीं मुझे 15-15 दिन में आता है, 8 दिन में ही आता है, या मुझे डेली आता है। और उसके बाद एक ऑटो इम्यून अर्टिकारिया रहता है। लाइक द ऑटो इम्यून डिसऑर्डर्स आर लाइक दैट ना, द पेशेंट्स की बॉडी इट फेल्स टू रिकॉग्नाइज योर ओन सेल्स, they are fighting against your own cells, considering them as a foreign. So likewise, so that in case of autoimmune urticaria, so we generally tell them कि 2 to 3 years का ये acute period है, उसमें हम rashes minimize करके, and some treatments are also there with the oral tablets and topical creams, or some procedural treatment you have to do to release that factors, but उनको उनके साथ फिर वो long term या chronic में चला जाता है। So acute का है, अगर if you are releasing the factor and your oral steroids you are giving and you are minimizing the itching and this psoriatic cycle, then that will be okay. But again it get, if it is getting converted into idiopathic thing or autoimmune thing or in a chronic urticaria, so basically they are difficult to treat if cause is not known.
Right, right. Well, moving ahead, I can see some questions coming from the live viewers, Doctor. The first question comes from Firoz Khan, who asks, can urticaria be a sign of an underlying condition?
Not actually, but we can tell them a cause, because basically some patients is getting some primary disorders and if he's under medications, तो उसके बाद हम पता कर सकते हैं, पेशेंट को बैक हिस्ट्री पूछते हैं कि आपको कुछ सर्दी खांसी हुई थी क्या, उसके लिए इफ यू आर टेकिंग सम मेडिकेशंस और समथिंग लाइक दैट, सो यू कैन लाइक सल्फा ड्रग्स की, बहुत सारे पेशेंट बोलते हैं कि मुझे सल्फा ड्रग्स की मैम एलर्जी है वो मत दे दो। सो बेसिकली पेशेंट इज नोइंग कि ये इस मेडिसिन खाने के बाद मुझे रैश आता है। सो या वी कैन सी कि कुछ अगर रैशेस है तो समटाइम्स देयर इज समटाइम कॉजेस लाइक फिजिकल थिंग्स और समथिंग, कोल्ड हीट, फिजिकल एक्सरसाइज, physical exertions or something, stress we can see, like some immunocompromised status like pregnancy. But sometimes after, if like thyroid and diabetic disorders also, the rashes are getting more. So with the proper like the like back pathway we can also evaluate for something. And for that, in case you are if you are having doubt after releasing the all the other causes, so we have to start doing investigations for that patient.
Right. Doctor, can hair dye or henna also cause urticaria? Is it possible?
या इज इट पॉसिबल, बिकॉज द स्टिमुलेटिंग फैक्टर कैन वेरी, हम ऐसा नहीं बोल सकते कि कुछ टॉपिकल लगाने के बाद हुआ कि नहीं और समथिंग लाइक दैट, बट अगेन द हीना और समथिंग डाइड अगेन हैविंग अ केमिकल्स, सो द ingredients if the patient is allergic to that, so it can have a local like the like जितना पार्ट में लगा है उसका भी रैश वहां तक ही उसको आ सकता है, और ऑल बॉडी कैन गेटिंग इन्वॉल्व. So kind of the fragrances they are like उसमें जो ऐड किया है वो फ्रेग्रेंसेस हो सकते हैं, कुछ इंग्रेडिएंट्स हो सकते हैं, सम केमिकल्स आर देयर, सम कलरिंग एजेंट्स आर देयर, से ऑल any aggravating or stimulating factor can cause the urticaria.
Right. And the next question, doctor, comes from Akansha Puri, who asks, can urticaria affect children?
या बेसिकली द इम्यूनो कॉम्प्रोमाइज स्टेटस, जैसे प्रेगनेंसी का भी मैंने बोला कि द प्रेगनेंसी, ओल्ड एज एंड चिल्ड्रंस, दे आर इम्यूनो कॉम्प्रोमाइज स्टेटस, मतलब क्या कि इनका इम्यूनिटी थोड़ा, हम बोलते हैं ना, वीक है। जैसे कोविड में भी हम बोलते थे कि लाइक प्रेगनेंसी या चिल्ड्रन है या ओल्ड एज है, उनको ज़्यादा हम कॉशियसली देखते थे क्योंकि देयर इम्यूनिटी इज ऑन लोअर साइड कंपेयर टू अस। सो बेसिकली हम उसके केस में से बोलते कि आप अर्टिकारिया चिल्ड्रन के केसेस में भी आ सकता है, एंड लाइक फॉर द प्रॉपर, और जहाँ पे हमने लाइक वीनिंग स्टार्ट किया है, द फर्स्ट फूड इफ यू आर इंट्रोड्यूसिंग योर बेबी, सो वी आर नॉट नोइंग कि नहीं इसको इसका एलर्जी हो सकता है। विद द पीरियड ऑफ टाइम वी आर कम टू नो कि नहीं इसका एलर्जी हो सकता है, या उसको इसका एलर्जी है, या उस स्मेल का है, समथिंग लाइक दैट। But with the introduction of first foods or liquid to solid or semi-solid foods, so in that case we have to come to know, जैसे एग वाइट का बहुत सारे चिल्ड्रन को भी एलर्जी हो सकता है, रैशेस आ जाते हैं। सो लाइकवाइज या चिल्ड्रन आर आल्सो गेटिंग अर्टिकारिया एपिसोड्स।
Right. Doctor, the next question comes from Anuja, who asks, how is the severity of urticaria measured?
Okay, so basically the severity with the signs, with the, if you are going to a dermatologist and getting proper evaluation, na, the signs may can involve again a lip swelling, there is a tongue swelling, there is a difficulty in breathing, so patient can tell you, and there is a change in voice also. So likewise with the signs we can evaluate the patient. But if you want to a proper evaluation, some lab test we advise to the patient, जैसे एब्सोल्यूट यूसिनोफिल काउंट हो गया, जैसे आईजी इम्यूनोग्लोबुलिन का लेवल्स हो गया, और जनरल हीमोग्राम, और इफ द प्रीसीडिंग इन्फेक्शंस आर देयर, सो डब्ल्यूबीसी काउंट्स और these neutrophils, lymphocytes, these all counts are very important in case of that. But according to the patient signs and symptoms we advise them.
Right. The next question, doctor, comes from Neha Sharma, who asks, can urticaria be a sign of an autoimmune disorder?
Yeah, basically the type of urticaria we can say it is a autoimmune urticaria, जैसे मैंने बोला कि जब sometimes the causes are not known, we are aware of causes and we have ruled out कि ये नहीं है, ये नहीं है, ये नहीं है. Sometimes we are difficult to find the cause also. These are the idiopathic urticaria, and autoimmune due to altered immunity, जैसे post COVID या during the era of COVID also, they are associated some diabetes and thyroid disorders, and due to that if your immunity is getting altered, and due to that altered immune response also you are getting a urticaria lesions. So yeah, basically their urticaria can be an autoimmune condition.
Right. Doctor, according to your experience so far, what was the worst case you have seen of a patient suffering with urticaria?
So basically the anaphylactic shock is जो जैसे बहुत commonly हो जाता है अगर patient is like misdiagnosed, or patient is avoiding to find a doctor and getting like proper evaluation or proper diagnosis na. So sometimes the like difficulty in breathing and anaphylaxis shock, and they can be converted into fatal conditions of the patient.
So is it life threatening as well? Is it
Yeah,
it
if
can
not,
be
if you
life
are
threatening?
ignoring the symptoms and sign, and if you are not taking any medications, if you are like waiting for कि नहीं ये अपने आप चला जाएगा or something, if you are trying some another pathway like home remedies you are applying, or ignoring the some serious conditions, जैसे lipedema है या swelling over the eyes है, if you are avoiding that, so directly the बाकी सब भी bronchus and larynx is getting involved, and if you are having a bit difficulty in breathing, so that is like a fatal condition only. So directly patient have to shift the ICU, and then anaphylaxis shock को हमको treat करना पड़ता है. So yeah, it can be a life threatening in such cases.
Right. Right. With that, doctor, it was a wonderful discussion with you today about the topic. Before we take a leave, any take home message for our viewers who has watched us so far?
Yeah, so the most important thing is never self-medicate. You basically
Hmm.
go to a proper dermatologist, a board certified dermatologist, and get a proper evaluation always. And don't ignore the symptoms. अगर if you are having a chronic kind of conditions कि ये ऐसे rashes मुझे आते ही रहते हैं, but just don't ignore. Try to find a good dermatologist and investigate if they are allowing, and then उसके बाद medications you have to take. Some there are some advanced treatments are also there, so they are treating you as well. So yeah, so it is very good thing to go to a dermatologist and get self the proper diagnosis and the treatment, so it will stress your it is also the stress relieving factor for you, your this thing, and maintain a good sleep, hydration, and proper diet, and maintain your lifestyle changes are their most important thing. With the proper yoga, meditation, diet changes, maintain your own diary, and try to find the cause and accordingly treat it.
Right, right. Well, that was the expert advice for today, and that was Dr. Aruna Pawar for all of us. Thank you so much, Doctor, for your
Thank
valuable
you.
time. It has been a very informative session for our viewers today, and I'm sure they will use this information to prevent themselves and the near and dear ones from getting urticaria. And in case uh, if they get to see such thing or such symptom, they know now what to do instead of self medication. It's always better to approach a nearby dermatologist. It was great to hear from you, and we look forward to many more such sessions coming times. Also, thank you, viewers, for your excellent participation. For more information on your skin health, like and follow our page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you.